discussing today. So we'll go through an introduction about Washtenaw County, what our health department does in emergency preparedness, some of our MRC accomplishments, our volunteer survey, MRC train, what we currently do for our training plan and our requirements, including a step-by-step guide, and then a couple of our cohorts or strike teams that we created this past year, along with some volunteer recognition events. So just to get started, here's kind of the breakdown of the structure that we have in Michigan for our public health system. So we are under the Michigan Department of Health and Human Services. They consist of 45 local public health departments. Washtenaw County is our local governing entity, which consists of elected Board of Commissioners, appointed Board of Health members, and then we have our Washtenaw County Health Department, which we belong to, and that is under the Emergency Preparedness and Response, and under that is our Washtenaw County Medical Reserve Corps. Also, I forgot to mention, if anyone has any questions while we're presenting, feel free to put those in the chat, and my supervisor, Kim, will be in the chat helping to answer questions, but we can also answer some questions at the end as well. So to continue, our community consists of 370,000 residents who all live in a 706 square mile of land area, and we are the 27th largest county in Michigan. We have 28 local governments and 9 public school districts, 6 college and universities, and our population is listed there. We have a lot of colleges in our area and universities, so that's why our numbers kind of look like that with our age groups. And about 17% speak a language other than English at home. And you can see on the right, we have a map of our county and all the different regions in there. All right, so our mission and our vision at the health department is to assure in partnership with the community and the conditions necessary for people to live healthy lives through prevention and protection programs. Our vision is a healthy community in which every resident enjoys the best possible state of health and well-being, and our core values consist of prevention, interventions, promoting social justice, and ethical principles. Some programs and services that are at the health department include emerging issues and outbreaks, community health services, environmental health division, epidemiology, community health promotion, our dental clinic, emergency preparedness, and our Washtenaw Health Project, which is now called the Washtenaw Health Plan, which is kind of like our insurance assistance program. So now we go into emergency preparedness and MRC. As you all know, the MRC helps support the emergency preparedness program. The unit consists of medical and non-medical volunteers. They support emergency and non-emergency work with the Washtenaw County Health Department. And if you want more information about specifically what we're doing and our website, it is linked right there. It's washtenaw.org/EP. And then we get into some of the accomplishments that we have done while I've been here. So our MRC was established in 2009, and currently we have around 100 active members after we went through and kind of cleaned it out a bit. So we have had 750 emergency preparedness kits assembled by the MRC in just 2 days. We had the MRC Strong grant help us with providing those kits and the supplies in them. I believe. Could be incorrect there. We've created 3 cohorts or strike teams within Washtenaw County MRC, including the mass fatality response, stop the bleed training, hands-only CPR and AED training, and currently we are also working on creating another strike team called the Emergency Response Volunteer Cohort. It's going to focus more on outbreaks, and we'll go more in depth about what these are later in the presentation as well. We also partnered and coordinated volunteers for this 2024 Detroit NFL draft. So we had some volunteers there. We also coordinated volunteers for a local hospital full-scale exercise. We've created 15 surveys to streamline program activities and evaluate our deployment events. And then we've created and finalized our MRC handbook, our orientation video, our training plan, and some of our recognition events. Some of those events included meet and greets. We created a photo album, and we had a thank you video that we created in April for Volunteer Appreciation Month. So kind of how we started with gauging interest and figuring out these strike teams and trainings was through an interest survey. So you can see to the right kind of what the results looked like. We received over 200 responses. We had to send out several reminders, about 4 to 5, so that they would complete it. And this was required to stay in the unit as well, because we wanted to make sure everybody was putting in their input. And our engagement and training results that we saw were for both virtual and in-person events, for Stop the Bleed trainings, emergency preparedness kit distributions, for meet and greets, lunch and learns, and they wanted to be recognized in shout outs via newsletters. That was all the feedback that we got there. Some other interests were in volunteer roles and response, personal and family preparedness, community resilience, and clinical management in a response. This is what our form looked like. I took some screenshots. So we had about 7 questions, kept it short, and gave them lots of different options to select from. And then if they wanted to give more feedback, there was also options for that. And here, oh, sorry, we had more than 7. There's some more there. All right. And so our orientation and training plan. So we have different requirements than you have in Illinois, but we were going based off what we thought would be beneficial. So we created an orientation video for all of our volunteers, just so everybody was on the same page. Because we've had people who've been in the unit for really long, and we've had some new members. So we wanted everybody, or newer members. So we wanted everybody to be on the same page. So we recorded a live Zoom presentation that went over our handbook, our policies, our requirements, and then we were launching a new MRC training plan that was going to be required. The presentation was required to be viewed by a specific deadline in order to remain in the unit. So we had it live, and then we recorded it and sent it out to people afterwards as well. And they had to just tell us that they viewed it. And then the next step was to create this MRC training plan, which was also required. And some of the trainings that we wanted to be included in that included family and personal preparedness and PPE standards, and then we gave them some options for other trainings to take, including ICS trainings, naloxone, psychological first aid, mental health first aid, and health equity trainings. So we did notice some challenges using the MRC train program, which included it not being very user-friendly. We've had to go in and manually enter some of the volunteers that were having tech issues. And it kind of led us to develop a guide that we sent out along with the training plan reminders. That way people could all have it very concrete. If their email was updated in train and if they had an account, I could enter them in manually, but if they did not, we have no way of helping them out in that sense. So we also noticed that some training courses did not update on their own, so we did have to go in and just check everybody's progress. And so we had to do that separately in an Excel sheet. But generally, it has been a great platform, and it's kind of putting everything together for us, which is good for the volunteers. This is what our guides looked like. So we had our MRC Train website step by step so that they can create an account and join our specific unit through the train site. And we put on all the links that they needed. And then we also, through trial and error and people's questions, put together a training plan guide where we put in some questions that we noticed needed to be answered. And so we put it all into one document. You can see that on the right. We noticed there were some issues with the way the screen was showing some things, so some people couldn't find where the training pop-up was. So different troubleshooting issues in that sense were also provided. So now we get into some of our strike teams. So we have created a mass fatality response team that was developed in partnership with the Washtenaw County Medical Examiner's Office to enhance mass fatality response. So I queried using our volunteer registry that we have through the state to come up with some volunteers that would be qualified to be in this team. And then we gauged interest and people who wanted to be involved and did all the requirements were in that team. So we got 6 medical volunteers, and so far they have attended the medical examiner introduction meeting. They've had a tour of the county's morgue at the University of Michigan Hospital, and they have all been fit tested for N95s as well. So the next step for that cohort is to view an autopsy at the morgue with the medical examiners. So that's exciting, and they are very hardworking, and they will be a great use whenever we need them. Hopefully we don't, but we have also created a Stop the Bleed training team. This was in partnership with the Michigan Department of Health and Human Services and MRC Strong. 8 volunteers and emergency preparedness staff received a Train the Trainer course from a staff member at the Michigan Department of Health and Human Services. And now we have our trained volunteers go out in the community and lead the trainings. We've had, I believe, 4 or 5 Stop the Bleed trainings out in the community so far. And here you can see a picture of one of our volunteers training a staff of a school district on how to stop the bleed. Our next one is the hands-only CPR and AED training team. So this was in partnership with our Huron Valley Ambulance. They trained our staff and volunteers on CPR and AED so that they can go out in the community and learn how to save a life. We have 4 volunteers in emergency preparedness program staff who received this Train the Trainer course, and the trained volunteers will also go out in the community to teach this training. We are still in the planning stages of still solidifying our content for that, but that is something we are planning. And then I forgot to mention the other cohort, but we also have been working on creating an emergency response outbreak cohort, and that is still in the works. That's why we didn't really have a slide on it, but it's to help relief or help our staff burnout by having some volunteers come and help us out with outbreaks. So next, I'll talk a little bit about our volunteer recognition events. Here you can see a picture of a meet and greet that we had. We had some volunteers show up to that, and we had just people asking questions if they had any, had some raffles. We also created a thank you video, and we created a photo album, and during Volunteer Appreciation Month, our staff signed some cards that you can see pictured there as well. Our staff at the health department, and so we showed that off at the meet and greet, and it's also in our photo album so that people can see it. And this photo album consists of just pictures that we've had in past events, and now we're trying to continue it with current events, and we bring it to different volunteer deployments or volunteer events that we have planned. That way the volunteers can all view it. And that's all I really had. So once again, thank you for your time. If you have any questions, please let us know. My name is Elisa Gefter. I'm the health educator and the MRC coordinator, and Kim is here as well on the call. She is the emergency preparedness program manager. And if you'd like to contact us, we have a volunteer email. It's called healthvolunteer@washtenaw.org. And yes, that is everything.
Thank you so much, Elisa. I'm going to give you guys a few minutes to just get the questions in your mind. I have one question I'm going to start off with. Why did you guys do the survey? Like, why do you think it's important to do a survey of your volunteers?
Kim, you want to take it or should I?
Oh, sure. Yeah, absolutely. Good morning, everyone. Thank you for having us today. So in terms of the survey, throughout our COVID response, we had onboarded many volunteers, assuming all of you did in a very rapid manner, just because of the needs in your jurisdictions. And so we had our initial MRC unit, which consisted of around 50 volunteers. And through the pandemic and our response efforts, we had onboarded hundreds of volunteers that we utilized because we had our mass vaccination clinics that we need to staff with over 100 staff and volunteers. So we had this large core of volunteers that were grandfathered essentially into our volunteer unit. And following as our response winded down, we really wanted to take a look at our unit and start to engage with them, start to offer some opportunities. We knew we had to advance some of our trainings. So we wanted to better understand where their interests were, their capacity. We have several of our volunteers that are retired. We have some that work full time. So we knew that there may be some challenges with activities, but also just really wanted to get a good sense of what their interests were. So we looked through the materials. We utilized our national reference guides and information to look at what types of activities we may be able to offer. And so we use that for our surveys. And Elisa had mentioned some of the challenges. Receiving responses can be really challenging. Just sending out an initial email doesn't mean that you will get the response that you are hoping. So we have learned that multiple reach outs, consistent, and possibly phone calls. We did resort to making some phone calls as well, which of course takes time and staff, but that did help us receive those 200 responses. And we also just wanted to give our volunteers who were in the unit but knew that they just didn't have the time, because we have our Michigan Volunteer Registry. There is another option for them. So if they weren't as interested in being engaged on a regular basis, they could remain in the Michigan Volunteer Registry. So we did lose many of those hundreds of volunteers, but the result was a more engaged, stronger, and trained unit. And that's where we're continuing and hoping that the training plan can support that as well.
So for the smaller units that may not have as many volunteers, it sounds like phone calls might even be the best scenario, especially if you have volunteers that may not have good connection to internet, or that is a challenge in your area. I think that's a great idea. If you guys have any questions, please raise your hand. That way I can call on you. Otherwise, I will continue to ask our speakers questions. How did the support to the medical examiner's office start? Like, how did that occur?
Right, I can take that one as well. So this really came about. I was working just with my role as the emergency preparedness program manager. I was looking at our mass fatality plans and looking at some updating, and I knew there was some work that needed to be done in that area. So I had made a connection with our chief medical examiner. And through some of our discussions and looking at updating that plan, she actually, our chief medical examiner, she had learned of some of the supports that other Medical Reserve Corps volunteers had provided for their own medical examiner offices to support that mass fatality response, and was wondering if that might be something we could look at. So that was the initial start. And so we had several meetings amongst the medical examiner supports team and our chief medical examiner to talk about what that eligibility or qualifications would look like, what their roles, responsibilities, what time commitment. And so we defined that through those meetings. And through another survey Elisa was able to send out, we queried our volunteers through our system, through the Michigan Volunteer Registry that had those qualifications, and then sent an email out looking for interest to be a part of that. And there was some specifics in terms of that qualifications. We were looking for medical volunteers that may have had some work in with autopsies, morgue, some education. So some that would have that, be able to work in that type of setting, because that is challenging and difficult work. And yeah, we had some interest, and it's been a slow moving process. I will say that, just to offer that, I'm sure you all know that things take time to develop. longer than you would think. And especially when you're working with partners and, while there's other projects and activities that may be pressing. So it has taken time to get where we are, but we're really excited about the partnership, and we see this, not only strengthening our emergency response, but also this opportunity for our volunteers to have some exciting work, be trained, because they'll be attending some additional trainings. And then the hope that we may even be able to do some exercising or maybe some functional exercising in the future. So it's been a really great experience, we think, for our volunteers, but also just looking at our county response and how we can support if that need is there.
That's
And
awesome.
and if I can add, originally our medical examiner did say she only needed like a handful of people. Like we only thought we were gonna get like 2 or 3. And then we saw that there was more interest in that even after the query. And so even that was just really great to see that there is that much interest coming from our unit. So just wanted to add that
Yeah.
as well.
I would assume you also had interest from your non-medical volunteers, but they were not eligible to assist with this. Okay, there are no roles that could that
Yes, yeah.
at least not right now. Yeah.
So as Kim mentioned, just because these are all kind of pilots, we wanted to have that specific criteria that the medical examiner wanted us to have. So yeah, it
Sure.
was only medical and people with experience already and
Okay.
that type of.
Yeah, what with determining the need, these will be volunteers that could potentially be deployed if there was a mass fatality or casualty incident,
Mhm.
and the support staff through the medical examiner's office was the capacity was lower. They needed some additional support, and the activities and roles that they will fill vary. It could be photograph, taking pictures. It could be tagging. So there were several different activities that or roles that were pre-established that we knew the qualifications. It had to be specific, and
Sure.
that's why we look to our medical volunteers.
I find this very interesting. I used to be part of a similar search team for the state medical examiner's office in Illinois, and I apologize. I don't know if that's ringing on your end, but and so they did train us, and part of it was finding body parts and tagging them, and so and that was part of the exercise. I thought it was very, very interesting. One of the reasons we're talking about this, guys, just to give you ideas, maybe something pops in your head as, oh, that's interesting. I wonder if I could pursue that in my area. I know that we have quite a bit of new or transition leaders um, on this call. And so if you have any questions or if anything is of interest to you, please raise your hand if you have any thoughts or questions.
We'd be happy to. We have some materials and resources. So if there are, if you're thinking of something and you would like to learn more how we developed, um, feel free to reach out to us.
Yeah.
Thank you. I do have my
And
last question about your emergency response outbreak team that you're just creating. How do you determine the roles that you can allow a volunteer to give you surge not replacement, because we always have to be careful that our volunteers are not replacing, but they're supporting, especially, there's some challenges, especially if it is a union position, but how are you navigating that?
So this particular strike team that we're creating and planning, um, the idea came from a measles response, unfortunately.
Okay.
When we were working through after action report debrief, we had some tabletop exercising because the it those cases were so involving for our health department and our staff and our nursing, our clinical team, that when we were discussing and looking at our challenges and our gaps and trying to, develop some improvement items, what we realized was the amount of work that our clinical team had to do with contact tracing, some of the contacts, the documentation. We knew that we had some gaps with staffing, especially this particular outbreak came during a holiday, right as a weekend near holiday. And so, of course, staffing is already thin. And so it started, the idea came from that after action report. And because we've already had this experience with these other teams, we thought that we could do something similar. And so that planning has been done in partnership with our clinical team, our nursing, our outbreak, communicable disease. Her title changed a little bit. Coordinator, to better define what that would look like. We knew that there was some additional training that had to be done. They needed someone that had some medical expertise, nurses, EMTs. So we defined what that role, similar to the mass fatality response team. And we're working on the job action sheet and defining what that role is. But these will be volunteers that we hope to utilize, that they're consistent, so that they will have a commitment with us. They may be deployed short term. It could be a couple weeks. They may have to be on site for a few days. So, that's a challenge in itself, just if we have volunteers. But to help support that work, reaching out, doing some contact tracing, some case investigation. And so they'd be working alongside our nurses. So that's kind of how we've initially defined that.
I love that. Okay. Basically a mini team to what everybody was doing during the pandemic, and just making sure you still have that group of folks.
Yeah, because a lot with a lot of the work that we do, and those roles may not be fully defined, which we certainly have just-in-time training when we have events. But this, we're hoping that having this group of volunteers that have initial training that we can call upon, that will help support in the future should we need that and our resources are limited.
Wonderful. Well, thank you. I know I asked all the questions. I hope those were helpful to somebody. Last call for any questions from the coordinators or state coordinator in the room. Okay. Thank you, ladies, so much. We were so grateful that you were willing to share with us what you're doing to engage your volunteers and develop your programs. We are currently in the midst of a subaward application round that will be closing at the end of January. So we love any ideas, any help that could spur some thinking and some brilliant thoughts with our leaders. So we appreciate you being willing to reach across to another state and help us out. Thank you, guys. Thank you, Lisa, for your presentation.
Thank you.
Absolutely. Okay. I know that some of you may not have seen the poll, and I realized as I wrote the text or the chat to take the poll that it might not be showing for you. So I'm going to relaunch a poll that I asked in the beginning. We are intending to translate the MRC brochure into the top 5 languages in Illinois. So that would be Spanish, Polish, Chinese, both Mandarin and Cantonese, and Tagalog. I was actually surprised at Tagalog because I'm Filipino. The Tagalog made it in the top 5. Um, we will offer it digitally, so we'll have it on our MRC website, and you'd be able to use it, send it, or print it yourself. We would like to know, what other languages do you believe it should also be translated into? So if you haven't taken this poll already from this morning, could you please answer and check all that applies for you? What do you think it should be translated into? And that way, um, we can use the strong grant monies and strategize how to best use those dollars. You can scroll down because there's a lot. It goes all the way from German, and if you scroll all the way down, it goes to French. And please click submit, and let's see where we're at right now. There's only 10 responses. Is there anybody else that would like to add your responses to this poll? We'd like to get a little bit more than 10 to give us some feedback. It looks like right now, Arabic is pretty high up there, and 20% of you believe that that's one of the languages we should additionally translate it into. Urdu and Korean are 10%, German's at 13%, Hindi is at 17%, and French is at 17%. Beautiful language. Wonderful. I'm going to keep it open, but please continue to add to that. What I'd like to do now is just give a couple of reminders. We know that we send reminders, and what we decided to do before Thanksgiving, we worked on a newsletter for you. Let me try to do the slideshow here, and let's see if it's going to do. Bear with me, because sometimes it will switch screens. We developed a newsletter so that all of the reminders are in one location at your fingertips. Okay, we don't subtitles. Sorry. Okay, hopefully you're seeing the slides in. It's giving subtitles. Is it showing you that? Okay, that's weird. We sent a remarkable newsletter. This will have all the reminders so that you have it in your fingertips. And I'm going to show you some of the most important ones so that you don't miss any of the offerings and resources that we have for the MRC Strong Grant. One of the most important things I want to stress to you guys, this grant ends in May. There's a lot of money, and we would like to give it to you. Like, we're trying to find ways to provide the resources and leave it in Illinois. So if you have ideas, please let us know. We'd be happy to hear it. But one of the ideas we came up with was to have the emergency preparedness supplies offer. So for up to $800, you can choose from a variety of emergency preparedness supplies, such as what you see on the screen. And there's more. But the link was sent on December 10th, and all of this is free. There's no cost to you. There's, I think, about 3 vendors, so there is some coordination on our part. Do not expect that when you submit your order that you will get it like in the next couple of days. We do have to process all of the requests, ensure that it does not exceed 800. Then we have to coordinate. Currently, we are over between 60 to 70 units in Illinois. We would love for every single one of you to take advantage of this $800 offer. Again, we don't want to leave the monies at the table and have to give it back. So we would love to give it to you. The orders must be placed by January 17th. And there's a reason for that, because we have another following offer to give you in relation to marketing. So use up as much as you can of these funds. That way we know what to offer you for the next one. So I mentioned the Remarkable News monthly newsletter. You'll receive this on a monthly basis, and we will tweak this as necessary as the information changes. But for the most part, Some of the staples will remain the same, just so that you have it. And we sent it out right before Thanksgiving. We will be sending it out right, I would say by this Friday, we should be sending it out again. So one of the reminders that we have is that we are doing 3 remarkable training workshops. And the first one already occurred on December 7th at the NIU Naperville campus. Can I ask anybody who is on the call who might have attended, just to encourage the rest of the folks that might be considering going to the Central Illinois or Southern Illinois, would you like to say anything about how the Northern one went?
Hi, it's Chrissy from McHenry County. It was wonderful. I had a couple volunteers there and they really enjoyed it. It was
Thank you.
packed for the day and very good information. I would highly encourage anyone to go and push it out to your volunteers.
Wonderful. Thank you, Chrissy. Is there anybody else that'd like to give a recommendation?
Really good swag too.
That is true. We are also going to give you goodies for everybody that attends. We will give you goodies, really good goodies. So please, please attend and encourage your volunteers to attend. Now, this is not just MRC. So if you have colleagues at your work or you have partners that you want to invite, or you want to use this as a recruitment opportunity and encourage, let's say, students at a nearby school to come and learn about the Medical Reserve Corps, get trained. We did have quite a number of people that were interested in the Medical Reserve Corps because they came to the Northern Illinois one. So this is free to everybody. So let's use the dollars and the opportunities. We're also offering continuing education credits. So 7.25 nursing CEs and 1 mental health CE. We are working on a pre-hospital CE. We can't announce it, what it is until we get it. And we're not sure it's retroactive, but hopefully we'll be able to get it for the Central Illinois conference. Okay.
Jeanette, can you change the slide or no?
I'm having trouble. Oh,
okay.
Can you see the agenda at this point?
We just see the first slide, the remarkable news.
Okay. For some reason, every time I do a slideshow, this is what happens. Let me just do it this way. I know it's not as professional, and excuse me, but you're going to see all the sides here. Reduce this. Okay. So this is the agenda of the, so I apologize. Let me go back to this slide. This is what I was talking about for the emergency preparedness supplies offer. You guys did see this? Chrissy?
We see it now.
Oh, okay. This
We
didn't come
didn't
up
see it
before. Oh, okay. Ah, okay. I apologize, guys. So this was what I was talking about. These are an example of some of the things that are on the supplies survey that you can choose from. There are a couple of different stop to bleed training supplies, Narcan, a couple of different tents, a couple ones that you can customize if you want the MRC logo on it. We're also offering the vests from last year and those nice emergency kits that we gave last year. I was talking about the newsletter that you received, and then I was talking about the training workshops from Northern Illinois, and now we have 2 more, one on February 8th, and then the next one after that. The last one will be March 15th in Southern Illinois. Again, free. And just to show you this, this has been a labor of love. We really did put effort and thought into what we wanted to offer to our volunteers and our coordinators primarily. So we're offering a basic track, an advanced track, and a leadership track. Now, you don't have to stay with that track. So if you have volunteers that are wondering this question, they can go to an ICS and then jump to a leadership track if they want to learn how to do public speaking or learn how to write better. Like you don't have to stay in the same track. We want you to just do and go to the sessions that you feel are going to feed you and teach you. We're also offering a first aid certification and a CPR AED certification that is limited to 20 per class. But we will have plenty of space, so don't worry, and we will pay for the certification as well. As I mentioned earlier, we are in the midst of the round 3, and we are offering 5,000 and 10,000 for the round 3 Merkle MRC Strong Sub Awards. Some dates to remember. The application closes at the end of January, and the reason for that is we want to give you time to actually work on your project, and the end of project report is due on April 25th. We try to extend it as much as we can, but the whole grant closes on May 30th. So we need to still collate all the projects and then write it for the feds, because we are responsible to write a federal grant report at the end of the year. Now, if they give us an extension that changes the game, we can extend things, but there's been no word on extension thus far. We will certainly let you know if that occurs, but please use these funds. Another note is that if you have applied for an operational readiness award, you are welcome to use the exact same project. You can just cut and paste if you'd like, but we have to have you attest that the funds you're using has to be distinctly used. So meaning you're using it to supplement or you're paying for something else, not what you said in the operational readiness award application. We also sent out now several months ago this local training opportunity for $2,700 that Merkle is sponsoring for you guys, so that you have a vendor, a trainer to come to your area and you don't have to go anywhere. They can be hosted in your location, or it could be virtual. Out of the 5 training offerings there, you would choose however many would fit under the $2,700. You can also use your own local vendor. But all the training requests have to be submitted by February 14th. Again, because there's coordination that's involved, and I'll just show you this in a second. And all the funds must be used by March 31st, because we will need to pay all those invoices. And again, we're bumping into the end of the grant year. So if, for example, you submit a training request on January 1st, it would not be realistic to think that you'll have a training set for January 10th. Like, it would take some time, because once you submit your training request and you decide whether you want to choose one of our vendors that we offer to you or your own, we still have to connect you with the vendor. You still have to fulfill whatever paperwork or agreement with the vendor that they require. And I think that's where people are getting caught up right now, where there's a stall, because if they have paperwork they need you to sign, you need to do that. And then we come back into the play and we will verify the total costs with them, because we want to make sure it doesn't go over 2,700. And if it does, we come to you and say, are you good with this? Can we proceed? And then the training is scheduled. So I show you this just to say there is some coordination involved. The sooner you put your training request in, the sooner we can get this going. So thank you. Thanks to all of those that have already submitted. And please, if you're stuck in that place of completing the forms, please do address that so we can get going. We want to use these funds. Also, a reminder, we are offering infrastructure support. So all of you can have up to 20 background checks covered for free. You can use Illinois Helps through the state, or you can use Sterling Systems, which I think there are some registration systems that some of you use that can connect better to Sterling. So they're completely up to you, but you can only use one, not both. And with Illinois Helps, you do have to have an account. You're an administrator, and then the volunteer has to sign up, create a profile, and then you would just check them off and do a background check with them. With Sterling, if you're interested in using Sterling, please contact us, and then we will connect you with Sterling, because they do have some paperwork they want you to sign. Again, we will pay for everything for up to 20 background checks. With liability protection, we still have a lot of money sitting here for you. Each unit can have $600 covered for liability protection. I know it doesn't sound like a lot, but there are volunteer insurance agencies. For example, VIS, I don't know if it stands for Volunteer Insurance System, but if you look up VIS and put volunteer insurance, it will pop up. and you basically cover the number of volunteers you typically activate. So if any given response or community event, you only really send out 10 volunteers, then just purchase 10. And the 600 is way more than enough, including the membership fee that they require. And it's the insurance is not tied to the name of the individual. So, for example, it's not tied to Jeanette Johnson or Marsha Wild or Kimberly Collum. It's tied to any 10, and they will cover any of those 10 anytime that they're deployed or activated. So, please consider using these funds. We want them to be useful to you and help you get over any barriers you might have for response or using volunteers for activities. And then again, we have the monthly coordinated webinars. Next month, it will be search and rescue training and development. And then the month after that, we're going to talk about Illinois Helps and the Sterling system. Thank you guys so much. Any questions? Let me look at the chat real quick. I thought I saw something. How do you know if the background check is complete? I think I did too, but I can't remember. Hi, Monica. Let's talk offline and talk about that. Okay. Any questions that I did not get to that you want to go ahead, Marcia? Hi, Marcia. You raised your hand. If you're talking, you're on mute. Okay. Oh, are you there?
Can you hear me?
Yes, I can.
Okay. So the Jot form platform. I mean, with this strong round 3 application, and I don't know, there was something else I was using the Jot form for, but I can use it, but if I elect to save a draft and then go back into that platform, I have a lot of issues trying to get back into that platform. And it says, send a code to get you back into it or reset my password, and they never send anything. So right now I can't get into Jot form. So I don't know if anybody else has been having issues with it, but
oh, okay. I've not heard of that issue, but I'm going to have Bethany follow up with you, Marcia. My recommendation to everybody is that if you're, for example, filling out your Civil Ward, fill it out on a Word document as you're going along to the best that you can. I know you have to fill it out on the form, just so that if you're going to pause, I don't know that it truly saves it, and I don't want you to lose it. So, and I know if you have to resubmit any application, you have to redo it again. But I'll check with Bethany and have her reach out to you, Marcia, maybe this afternoon, if that's okay.
yeah, that's fine. It's just,
Okay.
I didn't know if other people, but I kind of went on their website, and other people, not with MRC, but other people that use that platform, I think have had some issues. And I even tried to have their help desk contact their help desk, and I get no response.
I'm sorry. I do believe we have a free version of the Jot form, and I don't know if that has anything to do with it. But I apologize that you're going through that. We will try to rectify it, or maybe we set up a new account for you and see
Yeah,
if
it might be user error. I'm not the most perfect IT person,
It's okay.
but
We
I've tried a couple times, and
Okay.
it just, I get no response. So yeah,
Okay. We'll work through it. I promise you.
thank you.
Okay. Thanks, Marcia. Any other questions? Okay. Thank you guys so much. I know we got to go to the Region 5 call. Thank you guys. Have a good rest of your day.